Hi, my name's Erica, and today we're going to talk about viral hepatitis, including everything you need to know in regards to what to look for, what puts you at risk for hepatitis, and how common the disease is. So for starters, what is hepatitis? Hepatitis is a viral infection of the liver and can be spread to others. The three most common kinds of hepatitis are hepatitis A, B, and C, and all three of these can lead to severe illness or even death. So what kinds of signs would you expect to see in someone with hepatitis? People with hepatitis are often tired, can have yellowing of the eyes or the skin, also called jaundice. They might have aching muscles or joints and have a fever. Also, they might notice dark urine, pale-colored stools, severe stomach pain, vomiting, or diarrhea. So is there a way to check if you have hepatitis? The only way to know for sure is to get a blood test done by your doctor. Hepatitis A infects 21,000 people in the United States each year, but is usually an acute disease, only lasting 3 to 6 months without any long-term liver damage. Hepatitis B infects 38,000 people in the United States each year, but 2.2 million people have it currently and are living with it and will have it for the rest of their lives. Hepatitis C infects 17,000 people in the United States each year, but 4 million may have it currently and not have any signs that they're having it. It can take 10 to 40 years after developing the disease before you notice any signs or symptoms of hepatitis C. Even though that's a long time, and that's a lot of people affected, you can be treated, and you can get rid of the disease. So since so many people are affected by hepatitis, what puts you at risk? First, I'll just go over the risk factors for hepatitis A. You may be at risk for hepatitis A if you eat food that's been infected with the virus, if you travel to countries where the virus is common, if you come into contact with the stool of someone that has been infected with the virus, if your child goes to daycare with someone who has the virus, if you have close contact with someone who is adopted from another country where the virus is common, or if you use street drugs. Those at risk for hepatitis B and C include those who come into contact with infected blood or body fluid, sharing items that may have blood on them, like razors or nail clippers, body or ear piercings or tattoo equipment, and those born from a mother infected with the virus. There's a small population that might have gotten the hepatitis C virus in the past if they received blood or organs before 1992, blood products before 1987, if they shared needles to shoot drugs even once, or if they were born before 1945 and 1965. Some things that put people at risk of having any of the three viruses include living with someone who has the virus, having high-risk sex with someone who has the virus, and sharing needles. Since we went over those who are at risk for getting hepatitis, now we're going to cover a few ways that you can prevent and protect yourself from getting these viruses. One way is to avoid coming into contact with blood or body fluids. This includes not sharing needles or other items that might have body fluids on them, and practicing safe sex. Another way you can protect yourself is by boiling or cooking your food and water if you're traveling to a country where hepatitis A virus is common. It's important to wash your hands before handling food. It's also important to wash your hands after using the restroom or after changing diapers. There are vaccines available to protect you against 2 of the 3 viruses. Hepatitis A and hepatitis B both have vaccinations. However, hepatitis C does not. For more information on the vaccines and to find out if you've been vaccinated, talk to your doctor. There are tests available to see if you've come into contact with or currently have hepatitis. For more information on these tests, or for more information on any of the viruses, you can go online to www.michigan.gov/hepatitis.